Our first witness today is Dr. Al Kurose. Al is the president and the CEO of Coastal Medical in Rhode Island. He is a leader in Rhode Island's healthcare community, and I'm really glad to have him here today. Dr. Kurose has served as president and CEO of Coastal Medical since 2008. Coastal is a physician-owned medical group that serves 10% of Rhode Island's population. More than 90% of Coastal's providers practice primary care. Time and again, the Coastal Medical Organization has led the way in Rhode Island. Coastal Medical was a founding member of the Chronic Care Sustainability Initiative in Rhode Island, joined the Beacon Communities program in 2010, and had 49 of their providers join the Meaningful Use Vanguard as the first physicians in the nation to achieve meaningful use. This year, Coastal Medical announced a new contract with Blue Cross of Rhode Island that supports patient-centered medical home practice transformation and shared savings reform, the first of its kind in Rhode Island. Dr. Kurose is a member of the steering committee of the Chronic Care Sustainability Initiative of Rhode Island, the state's all-payer, including Medicare and Medicaid, patient-centered medical home demonstration project. He has been an active member of the Primary Care Physician Advisory Committee to the Rhode Island Director of Health and is also a member of the Health Insurance Advisory Council of our state Health Insurance Commissioner. He's a graduate of the Washington University School of Medicine in St. Louis and completed his residency at our own Rhode Island hospital. He has recently celebrated his 20th year as an adult primary care provider in East Providence, Rhode Island. Dr. Kurose, thank you for coming in from Rhode Island for today's hearing, and please proceed with your testimony.
Good morning, Senator Whitehouse. Thank you.
Senator Mikulski, who I was just bragging about, and Senator Bingaman, who have both joined us in addition to Senator Franken.
So good morning to all the members of the committee. As Senator Whitehouse mentioned, my name is Dr. Al Kurose. I am the CEO of Coastal Medical. Again, we have about 70 physicians providing primary care to 100,000 patients in Rhode Island, which is about 10% of the population of our state. I'm a primary care physician myself. I've had 20 years of experience in community-based office practice of adult internal medicine. I really appreciate this opportunity to present you with a quick snapshot of our work and to share our viewpoint from the front lines of the American healthcare system. The total healthcare spend in this country is approaching 18% of the gross domestic product. Published estimates suggest that 20 to 30% of that entire spend is waste. It seems clear then from these figures that the status quo of healthcare costs and healthcare delivery is not sustainable. I'm here to share the story of our organization, which I think is fairly unique. It's unique because we're much smaller than the large integrated healthcare systems like Virginia Mason, like Intermountain, like Humana. But we're much larger than the typical small 2 or 3 doctor primary care practice and larger also than most group practices. And that allows us to have built an infrastructure to support those practices in unique ways. So I think in some ways we may provide a valuable case study of building a progressive primary care organization really from the ground up. We adopted an electronic medical record in 2006. In 2007, as Senator Whitehouse mentioned, we helped start the state's all-payer, patient-centered medical home demonstration project, which is also a MAPSIP demonstration site. In 2011, all of our offices achieved NCQA Level 3 recognition as advanced primary care homes, and 49 of our providers were amongst the Meaningful Use Vanguard, the first providers in the country to achieve meaningful use of electronic medical records of health information technology. Federal incentive programs have been very important in our growth and development. Meaningful use funds, regional extension center funds, Beacon Communities funds from the Office of the National Coordinator of Health IT. We've availed ourselves of all those sources of support. And we have applications pending right now for the CMS Innovation Challenge Grant Program, the CMS Shared Savings ACO program, and the Advanced Payment Model, which provides working capital to smaller organizations who are becoming ACOs. We've set standards for ourselves at Coastal to meet the challenge of accountable care new standards. We do not intend to bend the cost curve, but rather to break it. We've set ourselves a very specific goal of reducing the cost of care for our entire population of patients by 5% by 2014. Our goal is not to be open more days for our patients, it's to be open every day, to be open 365 days a year with primary care access. And our goal is not to hit most of our quality targets, but every one of them. Last year in our Blue Cross contract, we had 20 quality targets. We hit 20 out of 20. Our organization was the first in the Rhode Island Beacon community to hit every one of its quality targets. And much of that success really, I think, goes to the physician culture that we've nurtured over a lot of years. So when you look at what federal government incentive programs have meant to us, it's reasonable to ask, what's the return on investment? The meaningful use dollars that we've accessed, some $750,000, what have we been able to achieve? And our data, our access to data is limited, but what we have from Blue Cross Blue Shield of Rhode Island in terms of our commercial and Medicare populations, we can say that our Medicare hospital days per thousand were reduced by 13% last year. Our readmissions on the Blue Cross Medicare side were reduced by 27% last year versus the year before. And if you look at the total cost of care for our Blue Cross commercial and Medicare populations, it went up by just 1.5 percentage points last year. Our goal for the future is an outright reduction in the cost of care. If there's 20 to 30% waste in the system, we think that we should be able to achieve that. Does care look different to the patients? It certainly does. As I mentioned, we're going to be starting 365-day-a-year access to primary care starting in July. Right now, we're at 6 days a week. Already, we have same-day sick visits in every office. Already, we have a new patient-oriented website up and running. Already, we have a patient portal through the internet to our electronic medical records so people can see their own test results and learn the status of their own health. And we already have nurse care managers and clinical pharmacists, key providers in every office. So our message from the front lines is that Coastal provides a unique example of a primary care-driven ACO structure, and it may be a model that can be generalized as a mechanism for bringing small practices together to meet the challenge of accountable care. Patient-centered medical home practice transformation has brought great value, but it's our strong opinion at Coastal that that's just an interim step and not a final destination for progressive medical organizations. Our new challenge, the challenge we're grappling with right at this moment, is to understand and manage the total cost of care more effectively for our populations. We do a lot of work in the extended primary care community at Rhode Island, and I can tell you that all of the primary care practices are really starved for data about utilization of services by their patients, about cost of services. If we're going to have a chance to really control the total cost of care, we have to begin with primary care practices having data to understand how the healthcare dollar is being spent. Our marketplace also suffers from a relative lack of price transparency. On the commercial side, we have a lot of people who are on high deductible plans now. When they purchase healthcare, they are pulling out their checkbook, and they have scant little information about price or quality of providers. So I think transparency is another piece that I would like to advocate. I see I've run over. I'm looking forward to question and answer. I really appreciate this opportunity to come here and speak to you folks. Thank you.
Dr. Kurose, before I let you go, can you just quickly answer this question? How are your phones answered at Coastal Medical?
Coastal Medical, would you like to see a provider today?
Today.
Today. Thank you.